And in 1939, based on the studies that had begun on kidney metabolism with Dr. Warburg and continued at Duke, he began to treat patients with very severe forms of hypertension with the rice diet. So this very extreme malignant hypertension was associated with kidney failure, with changes in the eye, so that the back of the eye, the interior of the eye, had hemorrhage and fluid collection. And at times the brain itself would swell, so the patient's brain function was gone. And most people with malignant hypertension up to 1939 had a median lifetime survival of 5 months. And Kempner, because of his studies on that, decided that the way to treat this would be to a diet that was extremely low in protein, in sodium, and in fat. So he devised the rice diet, and we can talk if we want a little about why rice, but this was white rice and fruit, and that was it.
Welcome, everyone. Welcome to Tuesday Evening Grand Rounds, Optimal Health Journey Grand Rounds. I have the distinct pleasure of introducing Dr. Frank Neelan. He's going to be our guest speaker and professor of the night. And I'm not going to delay because he has a wonderful presentation with lots of excellent information. Dr. Neelan began his work on the former rice diet program in 1996. Focusing on the clear value of the low-fat, ultra-low sodium rice diet for patients with type 2 diabetes mellitus. This has led to an understanding of how the time curve of weight loss brought about by calorie restriction and regular exercise, the glide path, relates to the improved sugar control needed in diabetes and guides the care of the patient at the Rice Diet Healthcare Program. He served in the National Institutes of Health for about 3 years and in a National Institute of Mental Health before returning to Duke, where he eventually joined the faculty in the Division of Endocrinology and the Division of General Internal Medicine. He retired from the faculty in 2002. And so Dr. Neelan is going to give us a talk on Dr. Walter Kempner's approach to treating patients with chronic illnesses in general, in particular, hypertension and obesity and renal failure using the rice diet. So without further ado, I'm going to introduce to you Dr. Neelan. Welcome,
Good.
Dr. Neelan.
Okay, well, thank you so much, Dr. Montgomery. Happy to be here. So here's our patient in May of 2011. He's allowed me to show these images as long as we don't show his face and we don't use his name. So for now, we're going to call him Patient X. And when he came in May of 2011, he weighed 435 pounds. He was 68 inches, 5 feet 8 inches tall. His body mass index, which is a measure of your weight for your height, was 66. Remember that most people, they think of a body mass index under 25 is okay. A body mass index between 25 and 30 is overweight, and anything over 30 is considered obese. Anything over 40 is considered severe obese. And I don't think we've recognized what it's being in this sort of stratosphere of obesity, but he was very obese. His blood pressure, we'll talk about this more at some length, was very high at 196 over 120. That's the range that would qualify for so-called malignant hypertension if he'd had kidney failure or eye changes or brain changes. Fortunately, he didn't, but he was in very great danger of that. And his blood sugar when he came was 295. A normal blood sugar should be under 100. So he's got obesity, he's got hypertension, he's got diabetes. And we're going to look at all those things and one other thing as we go through his case. So Dr. Kempner devised the rice diet to treat hypertension, and that's where we'll begin. At the time he started this, there were no other known treatments that were effective for high blood pressure. So as I said, if you were diagnosed with malignant hypertension, this very severe form of high blood pressure, there was nothing to be done except to see your lawyer so you could write the will while you could still sign it. But there was no medical treatment. So our patient's blood pressure was 196 over 120, which is surely severe. And it was at this level, despite the fact that he was already taking 4 potent antihypertensive medicines in full doses and not controlled. So look at what happened to his blood pressure when he started the rice diet. The blue dots show his systolic blood pressure, and it comes down nicely over the first month. And we're looking here at the target range of 130. We think that most blood pressure should be under 130 systolic. And he reached that at the end of day 12. 12 days of rice and fruit. And then we decided we could stop the first of these drugs. He continued to be in good control. So on day 23, we stopped the second. Day 43, the third. And on day, you can't quite see that, day 56, we stopped the last of his drugs. So after 1960, many drugs were marketed to treat hypertension. And so now it's rare to see people come and have blood pressure this level because the drugs are usually pretty effective. However, malignant hypertension itself seems to have disappeared from view. It's kind of gone away for reasons no one fully understands. It's like an epidemic wave of malignant hypertension that has disappeared from the United States. And I don't think we can blame treatment for it because most people with hypertension don't even know they have high blood pressure. So for whatever reason, there's a lot of malignant hypertension still in Africa. We have reached out to some folks to see if anyone in Africa would be interested in looking whether a sodium-restricted diet would be as effective in Africa as it was in the US, but we don't know about that. But since the fewer patients came to treat hypertension, Dr. Kempner decided to take advantage of the fact that it was hard to keep people's weight up on the rice diet. So the opposite of that is it would be good to get them to lose weight. And since our patient had extreme obesity with initial BMI of 66, he decided to look at what happens to his weight. So this graph shows now these ranges of overweight of a BMI. Anything above 25 to 30 is considered overweight. Anything above 30 is these classes of obesity going up in grade. And he started here at 66. And his weight came down steadily and regularly, and then it tapered off, and he did not get out of the overweight range. And the next point I want to make here, we've seen that it helps with the diet, helps with the blood pressure, certainly helps with weight loss, and it helps with diabetes. Now, Dr. Kempner devised the rice diet in the form it is in, rice and fruit, because he'd done all these experiments with tissue slices of kidney in the test tube. He was doing the work with Dr. Warburg, and he decided, based on his studies with those tissue slices, that decreasing the amount of protein that the kidney had to metabolize, because animal protein particularly, but all proteins have to have breakdown products of nitrogen, phosphorus, and sulfur that have to be excreted by the kidney. And he thought if he could lower the amount of work the kidney had to do by decreasing those components, the kidney could at least stabilize or possibly even recover from the damage that it had suffered. And in fact, that we've seen that over the years. Many people with rather severe kidney damage, if they followed the rice diet, did not find further progression. Whether they actually recover, I mean, it's a great argument about whether the kidney can regenerate at all, and we don't know that. The theory is that they don't. Unlike the liver, you remove part of your liver, you can regenerate that. But if you remove a kidney, you can't regrow one. But at least you could stabilize it, and they would not need to have anything further done. So we anticipate the rice diet should help and not hurt kidney function. So we were very surprised and perplexed when our patient's blood level of creatinine is a breakdown product that we all make every day in our bodies. The only way we get rid of it is to excrete it through the kidneys. If the kidneys aren't working properly, the level of creatinine in your blood builds up. So measuring creatinine is a good way to decide about kidney function. In our patient's kidney function, his creatinine level began to rise at a truly astronomical rate. So we were sitting there not knowing what to do. And then this is a lesson for you and me, Dr. Montgomery, and any of the medical people around there. The patient found a blurb on the internet that said occasionally, very rarely, so rarely that it doesn't have to be put in the package insert, exenatide, Byetta, can cause kidney damage. So at that time, as I told you, we were about ready to stop his meds anyhow. Well, we were not stupid enough to not follow what the patient said. We stopped exenatide, right? And when we did, this is what happened to his kidney function. His creatinine level has come down nicely and stabilized. Is it normal? It's not. He's had a loss of kidney reserve. This white area in here is kidney reserve. As long as you stay in that range and don't get up into the red, you're going to be fine. You're going to be asymptomatic, and it's not going to lessen your lifespan. And he's down there now stabilized in this very satisfactory range around 1.6. And as far as I can tell, this is not because of anything directly to do with the rice diet, although it didn't hurt him to recover when he stayed on it. But this was because he was taking this drug. It's still not in the package insert. So let's just summarize what we learned. Here's our patient in 2011. Here he is 6 months later in 2012. Here he is 18 months later in 2013. And here he is in 2022. Certainly a tragic transformation. And I just want to summarize what's happened to his weight is down from 435 to 194. He hasn't shrunk as far as we can tell. His BMI is down from massively obese to still overweight, but no longer obese. His blood pressure from this very high level to a very satisfactory level, although we've had to give him a half dose of amlodipine to do it. His blood sugar from 295, his last fasting blood sugar was 80. And his A1C from 10.7 to 5.0. And all of these other medicines have gone away. So the only side effect of the rice diet is that if you lose weight on it, you're liable to help your blood pressure, help your lipids, help your sugar, and get rid of all these side effect causing drugs. So if I could summarize I think I learned the lessons from this patient's story. One, Dr. Kempner's salt-restricted diet does indeed lower blood pressure. It does it effectively. Why doesn't everyone do it? Because it's not easy to really change your life the way this requires. If you want to get your levels to Kempner's levels of 100 milligrams a day, you can never eat out again. You can never eat processed food of any kind. The rice diet can lead to long-term weight loss. Is it better than the Atkins diet, the paleo diet, the all-white diet, the no-white diet? Nobody's done it, and it's impossible really to do the comparisons. They never get it done because if you look at these studies and say, we want you to eat this amount, and you find out how much they eat, it's always more. No one's ever really controlled, so I don't know whether I ever decide that, but calorie restriction does work. Measuring portion size is an absolute key to weight loss as far as I'm concerned. Calorie toxicity, not obesity per se. Calorie toxicity causes obesity and causes type 2 diabetes, but it's not the obesity itself. Surprisingly, a calorie-restricted, high-carbohydrate diet very effectively controls type 2 diabetes. And this cautionary thing, all drugs have side effects, even when they're not listed on the label. And if you can find a way to get rid of drugs or lower the dose, go at it. That's what we want to do. I would recommend the medical people, doctoring is a partnership. Pay attention to the patient. Our patient alerted us to this thing we missed that's not in the medical literature. It was out somewhere on the web, and he found it. And finally, eternal vigilance is the price of liberty. You cannot say I lost weight and now I can quit. You cannot say I control my blood pressure and now I can quit. You cannot say I have my diabetes under control and now I can quit. You have to stay at it. But under no circumstances should you take a diet as restrictive as the rice diet, that is rice and fruits. Never should you do this on your own. It is too risky. Not risky because people get sick very often on it, but rarely they do. And when they do, you have to be alert to it and respond to it. Well, the closest diet that I know of that fits this bill is the so-called DASH diet. The DASH diet stood for Dietary Approach approaches to stop hypertension. With an elegantly controlled study showed that if you ate a diet that was largely vegetarian, small amounts of poultry and fish, small amounts of low-fat dairy, you could lower your blood pressure just by eating that diet. And they control weight, so weight loss was not part of this. And this shows people eating the controlled diet, they did not have bad hypertension, but their blood pressure on average was 133. And just eating the rice diet with a normal amount of sodium in the diet, their blood pressure came down to 127. Doesn't sound like a lot, but even 2 or 3 millimeters of mercury fall in your pressure will cause a significant cardiovascular improvement. When they restricted sodium, it came down on the DASH diet when they restricted sodium. My only complaint with this is they stopped at 1,500 milligrams. Dr. Kempner was over here at 100 milligrams.
Dr. Neelan, we will end it here. This is an excellent presentation. Thank you again. And I'll definitely be in touch. I'll give you the follow-up on our experience with the rice diet. We'd like to get follow-up on your data analysis.
Our goal is to try and get that out because the donor that funded this project, the main thrust is to get Kempner's data out in the world again and not let it just fall into disarray. So
well, good.
You will be.
Thank you again, Dr. Neelan.
My pleasure.
All right. Good night, everybody.
Good night, all.
Good night.